Welcome to Forward Thinking. Because the world is moving fast, the world of health insurance also needs to. I'm joined by an expert panel of speakers today, and we've got a jam-packed agenda. We'll be joined by Greg Levine, our Chief Operations and Growth Officer, to give you a brief overview of the key takeaways from our latest Vitality Claims and Insights report. We'll have an industry debate with our expert panel, followed by a deep dive into the healthcare landscape and the evolution of PMI from our Managing Director for Vitality Health, Dr. Keith Clintworth, before we come back to our panel to reflect on some of those insights and then into a live Q&A. So get those questions in, we'll make sure we ask some of those at the end. Before we get into the discussion, I'm delighted to introduce Greg Levine to give you a quick overview of the Vitality Claims Insights report.
Thank you, Adam, and thank you all for joining us today so that we can share our Health Claims and Insights report with you. This webinar is really an opportunity for you to all be appraised of the changing nature of the health insurance environment in the UK. And I must say personally, I found the report to be very insightful and actually helped me shape my thinking in terms of how I believe we need to deal with customers and how we need to evolve in order to meet the changing customer expectations that we're all going to deal with every single day. When one looks at the report, the three key insights are as follows. Number one, prioritizing prevention is working. I stress, prioritizing prevention is working. The Vitality program can help people to live almost 5 years longer. They also on average claim 28%, and I stress 28% less in terms of their healthcare costs over time. Number two, people are using their health insurance cover more. This is a big change. We've seen Vitality health insurance claim increase by 45% since 2019. Now, this has been driven mainly by more demand for everyday care, which accounts for 64% of all claims. Number three, importantly, we've all seen the evolution of technology, but this power of technology is now transforming our world and it's transforming our claims journey. 64% of all of our claims now start online rather than with a customer needing to pick up the phone. This is helping us to connect better with our customers and also connect them to the most appropriate consultants. Patients treated by Premier consultants are actually 27% less likely to be readmitted to hospital after their treatment. To find out more, visit our website to download the report. I have no doubt that you'll find it hugely beneficial. Now back to you, Adam, to unpack more details.
Thanks, Greg. So to really get under the skin of this issue, I'm joined by an expert panel of speakers. As we just heard from Greg, there's been an awful lot of change in the PMI market over the past 5 years, whether it's the explosion of primary care within the proposition, the need for prevention, which is clearly not going away, and the need to find more cost-effective ways to manage demand. So, Dave, what are some of the things that you've seen over the past 5 years?
Without a doubt, there's definitely been an increase in demand from individual, consumer, through to corporate PMI policies. I think that's driven from a number of reasons, really. Obviously, we all are aware of the NHS challenges, which is driving interest in private medical insurance. I think we see more and more employers wanting to look after their employees. But one of the main things I've seen relatively recently is the challenge that we've got with primary care. So getting an appointment with a GP is a particular challenge. So virtual GPs, which comes as an addition to a private medical plan, are really driving a lot of take-up, in my opinion, of medical insurance. Now, if I can just give you an example of why I think that's so important. So I was very lucky to do a podcast with Professor Willie Hamilton, who's an eminent cancer diagnostic specialist. And he said to me in this podcast that 95% of cancers are actually diagnosed through symptoms. So if you're not going to your GP or a GP when you've got a symptom, there's a problem. Now, he also said that for every week that you delay, if you have got a cancer, a serious cancer, it reduces your lifespan by 1%. Doesn't sound a lot, but you add a few 1% up and suddenly you're in real trouble. So I do think that that is one of the reasons that we're really seeing an increased demand so that you can actually get access to primary care.
And we'll come on to kind of early intervention in a little while, because I think it's a really interesting point. But Nikita, looking at the health landscape from a clinical point of view, how well are we as a nation, and how is PMI playing a role in supporting the health of our nation?
So it's an interesting time at the moment. 2/3 of our population are probably overweight or obese. We have an ageing population, and as Dave says, we have a real problem in accessing primary care from an NHS perspective, and that's where PMI really comes in. In our everyday care proposition, we offer physio, mental health, GP services to our members, and we're seeing almost 60% of claims in terms of multitude rather than magnitude coming to our everyday care benefits. And that really shows what people are accessing, really PMI, how they're using their PMI. I think in order to make it relevant and make it sustainable, it's really important that we look at smart ways of balancing this utilization and demand and making sure people are getting to the right place each time, first time.
So that's the key point, isn't it, Athos, when it comes to ensuring that healthcare is sustainable, ultimately, making sure that when it comes to things like prevention, we're looking at it from an end-to-end point of view, ultimately. And as Nikita just said, kind of driving more streamlined, more effective routes into care when they do need it.
Definitely, Adam. I think that as important as early intervention is, in fact, prevention. And what we see, and has been widely reported, in fact, as recently as 6 months ago in the United Nations and World Health Organization event, which we hosted here in these offices, we learned that the world spends far too little money on prevention. And this is a mantra that we've had for many, many years within the Vitality Group. And just to Dave's point of early detection, prevention and early detection go hand in hand. And this is one of the reasons why we are so hell-bent on making sure that we offer that wide spectrum through screenings, through primary care, to make sure that we are able to intervene early, because we know that that gives our members the best possible health outcome, but in turn it gives us the ability to manage our downstream claims. And that, from a sustainability perspective, is absolutely cardinal. And so when we talk about this massive eruption of primary care usage, this is not something that was a surprise to us. In fact, by very design, we put that into our process so that we could make sure that we're getting there early, and, to Nikita's point, are directing our members to the best possible specialism for their particular condition.
And one of the things we've found in the Health Claims Insights report was actually kind of prevention is more than just supporting and promoting healthier lives, right? And Nikita, could you please talk us through sort of the 3 stages of prevention? We've got kind of some evidence in the report that talks us through primary prevention, secondary prevention, and tertiary prevention. So what exactly is that?
It's really about our kind of 3-step model, which is making sure people are aware of their health, that we make it really easy for them to improve their health, and then thirdly, to incentivize and reward them for improving their health. So the primary, secondary, tertiary prevention is really about wrapping that person in care from before claim, during claim, and after claim, and providing value for that person all the way throughout their journey. In terms of primary prevention, we have the Vitality Programme, which supports and incentivizes physical activity and walking and steps. In terms of secondary prevention, we provide health checks for people, we provide cancer risk assessments for people, and we've seen a huge uptake since the launch of that cancer risk assessment last year. In terms of tertiary prevention, we support people during and after their treatment as well. So, for example, with members who have cancer, we offer a really 360 kind of approach to their care, providing them physical support, providing them mental health support and nutritional support. And we've seen a 32% reduction in stress and anxiety, a 30% increase in physical activity, and an improved quality of life for those members. So that's really where we're making a really big difference, I think, end to end for our members.
Which ultimately leads to that long-term goal of helping them live longer in a better state of health. And if you would like to see some of those figures, there's plenty of them in the Health Claims Insights report. But Dave, turning to you for a moment, when it comes to well-being, I mean, it feels like as an industry we've been talking about prevention and well-being for some time now.
It's a really good point, and we have been talking about it for a long time. And I think the challenge we have is that it's not black or white, and we don't have enough data within the workplace to be able to provide the right solutions at the right time. Nikita's point about mental health is absolutely vital, because in my opinion, I do talk a lot about mental health, but unless your mind's right, you can't get your body right. So I think we need to provide our employers and ultimately the employees with more data about what's happening within the workforce, without a shadow of a doubt.
Absolutely. I mean, it's clear that no longer is well-being in the workplace a nice to have, right? It's a need to have. It's something that employers are asking for and expecting. From your side, Athos, this kind of role of data and insight, the proof in the pudding ultimately that prevention is working, works both ways, doesn't it? It works from a point of view of showing that behaviour change is possible, but also showing to employers and organisations that actually productivity gains are possible. Lower absenteeism and presenteeism can be achieved through healthier people ultimately.
Adam, I think that data goes so broad, and we use data in so many different ways within our business. This whole zeitgeist of AI presently in the common consciousness is not a new thing. We've been using AI and data in our business for many years. It's helped us to understand and to put into place programs and incentives and personalization and next best action and all of these interventions which help us to help our members to be healthier. I think that it's also true that these things are interconnected. So physical and mental well-being are absolutely connected to one another. Nikita raised the issue of an increase in physical activity. And in fact, interestingly, over the last short while, we've seen a doubling in engagement in the Vitality program. And I think that as a result of people being more conscious of wellness, well-being, probably accelerated by the pandemic, Dave. But the combination of things working together is an interesting one to watch, where you've got physical activity rising and at the same time people being more aware of what their diet looks like. And so when these things start multiplicatively having a positive effect on wellness, that's a fantastic thing. I think Dave's point is absolutely right, though, around giving our members, sometimes through their employers and sometimes directly, more clear and granular data around what their state of health looks like. And in fact, we are in the process right now of improving the granularity of that data around engagement in the Vitality program and the impact thereof. Back to the Claims and Insights report, a lot of information in that around the actual physical impact of these interventions on incidence rates, on recovery rates, on all those kinds of measures. So very, very powerful stuff.
I think many employers that I've seen in the past have put in place policies and just put in place the latest vogue benefit for their employees, and there hasn't been the take-up, and I wonder why. Because the employee has no idea what to do. They've got 30 different wellbeing pieces coming at them and they don't know what to do. Whereas, just going back to the data, and I love data because it changes behaviour, if we can tell our employers what's happening in their workforce, and that might be that there's an issue with obesity, which kicks into diabetes, which kicks into cancer potentially, then that is so powerful, because then you can start putting in place strategies to deal with a specific issue.
And it is about being strategic with that data and making meaningful changes. I think one of the things we saw in Britain's Healthiest Workplace data is the sheer amount of multiple interventions an employer has. And actually, to your point, Dave, sometimes less could be more ultimately if you're making sure you're delivering the right initiatives in order to answer the kind of the flashpoints you may or may not have in an organisation.
One of the interesting things, Adam, around behaviour change, and it's something that we as a business have been wrestling with for a very long time. Behaviour change is much, much more profound where people's health is not that good. So the fit, healthy young person will benefit from the Vitality program, but nowhere near to the same extent as a person who may be older, who may be a smoker, who may be obese, who may have comorbidities. And our opportunity to positively impact that member's life is significantly different, and the benefits that they derive are immeasurable. And that, I think, is an area that we as an industry need to focus on. Is Nikita was talking about obesity rates, and it's not UK specific. This is an international trend. Dr. Tedros Ghebreyesus was talking about intervention taking stress off the healthcare systems of the world, not just the NHS. And for me, this is something that it's an exciting opportunity we really need to get to grips with.
And it was the Habit Index recently, which was research that we conducted with the LSE, which actually revealed that steps 3 times a week, so someone just walking 5,000 steps 3 times a week can save the NHS £15 billion. And to that point, how small changes can make a huge difference across the population.
One last point. Going back to my podcast with Professor Willie Hamilton, I asked him the question, what can we do to kind of reduce cancer? He said, you know what? It's relatively simple in some ways. We walk more, we eat better, we sleep better, and we don't smoke. And it reduces the number of cancers that happen.
I mean, is it around sort of the preventable burden, health burden in the UK? Is it?
I mean, that's absolutely right. What we've done with our data is support people to make the right choices, give them that really next best action. I think at the moment, people are flooded with just so many different choices, so many different opportunities, and employers, people are spending so much on everything. But I think what we can do from a Vitality programme perspective and from our kind of everyday care perspective is really support people to have that next best action that's going to make the greatest improvement to their life and to their health outcome.
Targeted interventions. So before we sort of hand over to Dr. Keith to give us a bit of an overview of the healthcare landscape, just to kind of wrap things up for this section of the panel discussion, what does all this mean for brokers and ultimately employers too? I'll start with you, Athos.
Well, let's start with our members for a second. I think that the member needs to be at the centre of this universe, and whether it's us viewing the member or our intermediaries viewing the member or indeed employers viewing their employee or our member, I think if we start with that as the beginning point, I think everything else should fall into line. I think from a vitality perspective, personalisation is a massive thing, and that's our next evolution in terms of how we want to improve the member's journey, experience and outcome. For example, we know that pre-surgery, if you're a smoker and you quit smoking, and Nikita will correct the numbers, but if you quit smoking 72 hours before your surgery, your wound recovery time is improved by something like 30%. So if we're able on a personalization basis or a personalized basis to reach out to our member and say, Adam, we know you smoke and we know you've just requested authorization for a knee replacement. If you quit smoking, these are the benefits, and you do. And then we reach out to you again and we say, now that you've had your operation, how did it go? You've probably been in hospital for a week, so you haven't smoked for a while. This is a great time to quit smoking forever. That's vitality in action for you. So that's one point that I want to make. The second point is, in terms of all of those things again, the use of the smart technology which we now have, digitalization, the ability for our members to start a claims journey online, but to always have the ability to break in or out of voice is critical. Mm-hmm. And I think that all of these things talk to the value of the proposition which we provide. The statistics around usage are mad. The volume, the percentage of members who are using PMI every year is rapidly increasing, but talks to the value of the proposition. So I think from an intermediary's perspective, it's an exciting time because I do think that we have the opportunity to significantly grow and to provide great benefits to many, many more members. Same thing for employers. I think attracting and retaining the right staff and managing the absenteeism and presenteeism you spoke about is really keen. And our members should get the better outcome from that all.
And Dave, from your point of view, this proposition, the health insurance proposition has evolved. It's expanded. Mm-hmm. Surely that must be having an impact on the sorts of conversations that intermediaries are having, whether they're organisations or individuals.
Yeah, I think it gives the ability for the intermediary to have more strategic conversations about what they're trying to achieve at a corporate level and what they need to get there. With their people. So, I thought it's absolutely spot on making it personal. I think sometimes it's a challenge for people like Vitality and other providers to get to the end user because you've got the intermediary blocking it. Sometimes some of the messages, it's diluted, but I think getting to the end user is a real positive. I love the gamification of what's happening. If employers are there doing their steps together and getting to the top of a leaderboard, fantastic. So let's have some meaningful data, some meaningful conversations so that you can shape your wellbeing strategy based on your business.
So now we're going to turn to Dr. Keith Clintworth, who's going to give us a bit more insight into the healthcare landscape and how the PMI proposition is evolving.
Thanks, Adam. It's clear that the healthcare landscape has transformed fundamentally over the past 5 years. We've witnessed unprecedented growth in demand, and private medical insurance has had to move forward to meet changing consumer needs. As a result, health insurance is entering a new era. It's no longer enough for PMI to simply cover the costs of hospital treatment for major illness, so it needs to offer much more than traditional health insurance. Primary care services such as virtual GPs, physiotherapy and mental health support have become a fundamental, integral part of health insurance. Importantly, everyday care services now account for over 60% of Vitality health insurance claims. More than half of Vitality GP requests are managed in an everyday care setting through medical advice or a prescription. By seamlessly integrating these services into a care journey, PMI is being used more effectively to send patients to the right care pathways based on their needs. It might also be misinterpreted that increasing utilization of everyday care services is driving higher claims costs. By focusing on the top of the funnel, either through preventative healthcare and/or well-being, or by quicker diagnosis and treatment within everyday care, earlier intervention in a primary care setting is in fact leading to more healthcare sustainability through lower secondary claims. Despite the use of talking therapies having increased significantly in recent years, actual severe mental health claims reduced between 69% and 74% between 2019 and 2023. Similarly, a rise in the use of physiotherapy since 2019 has correlated with a 31% drop in musculoskeletal claims during that period. This underpins the notion that offering more can, and in reality, cost less when it comes to meeting individual healthcare needs earlier to prevent more severe problems later down the line. At the same time, our nation's health is not improving. Encouragingly, we've seen firsthand that incentivizing positive lifestyle choices is helping people to lead healthier, longer lives, as well as reducing healthcare costs. On average, Vitality members record a 13% increase in physical activity and a 20% improvement in diet in their first year using the Vitality program. This benefits our members and indeed wider society by preventing ill health before it emerges and improving treatment outcomes if it does. It also benefits us as an insurer, allowing us to manage claim costs over time. Meanwhile, secondary prevention services such as health checks, screenings and cancer risk assessments help to ensure conditions are picked up earlier and appropriate diagnostic pathways are offered. It's for this reason that in 2023, Vitality launched our new cancer risk assessment, enabling earlier cancer diagnosis for common types of cancer. Since the introduction of the service, over 14,000 members have completed an assessment. As well as reducing the risk of people getting ill in the future, well-being support during and after treatment can improve health outcomes in a clinical setting too. What is also coming through in our latest Claims Insight report is that private medical insurance's emergence as healthcare in the palm of your hand is serving as an effective means of directing people into the correct care pathways. Since 2021, engagement via the Vitality app has doubled, and through a deeper integration with CareHub into the client journey, 64% of Vitality Health claims now start online. Through Premier consultants that are assessed based on more than 500 data points and quality metrics, we're demonstrating better patient outcomes through fewer hospital readmissions, reduced length of stay, and lower total cost per claiming event. All this is helping us to drive greater operational efficiencies through these seamless pathways in line with changing customer expectations to ensure we deliver more effective forms of care in the most cost-effective way possible, whilst enhancing the customer experience. From prevention all the way through to care, and then getting you back to the best state of health that you can have, with or without living with chronic conditions, to drive healthy living years. Back to you, Adam.
Thanks, Dr. Keith. Some really fascinating insights there. And we've just heard from Dr. Keith that people are using PMI more than ever. And actually its role as a product has changed from its traditional role as a product that covers treatment and simply that. Making sure that through that GP consultation that the individual is sent to the right next course of action, that the right pathway for them through digital means in particular is another way to ensure that you're using innovation to deliver care more effectively.
Yeah, so we see around actually 60% of our claims start online, and that can be from seeing a Vitality GP all the way through to claiming. And that drives a really easy digital experience for that member. So around 2/3 of our secondary care claims are actually delivered through Premier consultants. We select our Premier consultants based on their clinical outcomes, so things like their readmission rates, their length of stays. And so we direct and support people to choose those right pathways from our GP services.
And we've talked a lot about data today, and actually one of the examples you've just raised there, Dr. Nikita, around Premier consultants, which are ratified and qualified based on 500 data points, internal and external data. That's ultimately an opportunity to really kind of enhance the directional care pathway to make sure that individuals, members, patients are sent through to the right consultant for them in a way that can actually improve health outcomes in the long run.
Yeah, absolutely, Adam. I think that, again, going back to the member being at the centre of the universe, if we're focusing on making sure that the quality of the care that our members receive is absolutely unquestionable, that the speed, the access that they get is unparalleled, that's got to lead to better outcomes for our members and ultimately better claims experience for ourselves. Talks to our shared value model.
Absolutely, and Dave, what we're ultimately talking about here is kind of healthcare in the palm of people's hand, and you've been quite outspoken in the market about the need for innovation to help drive efficiencies and more effective forms of care. So what's the role of digital care? Are we in a position now as a market where we're ready to really embrace it?
I think before I answer that question, our industry and the protection industry has to work closer together, because if I'm, and you've mentioned Athos a few times, the end user, if I'm an end user and I don't know where to go because I've got a GP with my group income protection, I might have it with my group life and I've got it with my private medical insurance, what do I do? So before we go into innovation, let's make sure that the end user, the person that really, really matters, knows where to go for treatment. And I think that's a tough one to answer, but it makes things a lot simpler. In terms of innovation, we haven't talked about artificial intelligence. I think for you as a provider, in terms of claims and underwriting, that's going to really speed up things, which is good. In terms of the end user, again, look, I love apps. I think the more we can do on our phone, the better it will be, and that will ultimately impact on the outcome.
And isn't that exactly the point as well? Is through PMI now, I mean, we've all agreed today that the PMI proposition has evolved, it's changed, right? There is a room here for almost kind of like a catch-all healthcare solution, which can provide all of your healthcare needs all in one go, where that engagement not only doesn't just drive up costs, but actually drives up healthier lives, gives better access to care when they need it, in the long run supports the outcome over time. Any thoughts?
Well, I just think for me, it's exactly what Vitality stands for. If you look at what we've said over and over again, and we've hung our hat on for 30 years, the shared value model, which talks about the benefits for all members, all people in the ecosystem. So we've given back £82 million worth of benefits in excess of claims over the last 12 months. That's massive. Now, if we're giving not only awesome care, as we've been discussing all day today, but also additional benefits in terms of rewards and our improved health outcomes for our members. That's part of the shared value model. And the final bit is the societal impact, which is the positive that we bring to the greater healthcare system in the country. And I really think that we have a very profound benefit and value to bring. And I'm excited about what the future holds.
Do the members know all this? Do you know, or is it something that's at a corporate level?
So, Dave, we do communicate with our members in terms of what their actual benefits have been in terms of partners and rewards, but I do think there's more that we can do. I specifically think about the value that our members derive from primary care, as an example, and this ability to access the thing that they're paying their premiums for on a much more immediate basis, I think does change the value equation. And I think that our members do now value PMI generally much more than they ever have.
Yeah, because back in the day, all we had as data was claims, wasn't it? And that was okay, because it told us what people were being treated for. But if you've got 60% of members using the PMI policy, that's great. But the other 40% need to understand what's happening as well.
I think there's still really much more that we can do to get people engaged. We're seeing a 28% reduction in claims costs for our most highly engaged members. But how do we get those people engaged, the other people engaged? And there's much more work for us to do in that.
Well, the research that we did recently, the consumer research conducted, which is mentioned in the report, actually revealed that 75% of consumers said that they expected health insurance to do more than just support their treatment. And that could be supporting lifestyles, healthier support for lifestyles, as well as other things like screening and some of the things that we've talked about today. So actually there is a real appetite within the customer base to engage. And we've already agreed that kind of digital offerings are, you know, ubiquitous now. We're very much kind of interacting with smartphones. I think 80% of articles read online are digitally read. So, you know, gone is paper, in is the digital. So I think no longer PMI is a product that gets bought, forgotten about, and put in the shelf not to be used. I think there is this real kind of opportunity to grasp the nettle around utilisation.
We're going to get more and more of wearable devices, aren't we? And those wearable devices will give more information to you guys and girls, which will enable to make better decisions, to give better outcomes.
Absolutely, yeah. And actually, interestingly, one of the things that we do see in the Vitality research is that it's not just fit, young, healthy people that are benefiting from the Vitality proposition. We're actually seeing that our older members are also getting, if not more, health benefits from the utilisation of wearable technology and engaging with healthy lifestyles. And actually, a younger consumer base are now looking into PMI as an offering, given the pressure that the NHS face.
And I think there's a really a big change in the culture of what people value and what people see nowadays. You know, back a few years ago, before COVID, I think health was health. health now is health and wellness and your environment and everything. And I think that's where we really excel with what we're doing, because we're offering lots of different things that are tailored to lots of different people, and acknowledging that different people will benefit from different things.
And I think it's clear for us all to see that the world is moving fast ultimately, and I think us as an industry, the PMI industry and the protection industry, Dave, has to move with it, right? And which I guess brings us to our kind of wrap-up question before we head into the live Q&A, and I hope you've been getting your questions in, and if you haven't yet, please do get them in. We'll ask some questions to our panellists at the end. But yeah, just to wrap things up, what is the direction of travel? What can we expect over the next sort of 6, 12, maybe even 2 years?
I think that the change in government is going to be very interesting. There's not a lot in the manifesto about our world. There's not a lot about the tax breaks, etc., etc. So in that regard, we've got to wait and see what's happening with the new government. For me, well, in the past, Labour haven't wanted queue jumping, so haven't particularly been on the side of private medical insurance. I think our job is to educate about prevention. Prevention, because I think that people will listen once we start proving, again, going back to data, that prevention does have a massive impact on employers, the National Health Service and individuals.
Brilliant. Nikita, any thoughts?
I absolutely agree. I think prevention is the absolute key. The risks to our society are not changing in the immediate term, and actually we need to use our data to support people to understand their health, and then use collective data to drive the right pathways to ensure that our members' outcomes improve.
Yeah, the opportunity to send people through the right journey that's right for them in a way that creates the most effective outcome and the most positive health outcome possible.
Look, we've spoken a lot today about technology, about data, and about members and consumers. And I think that our consumer base, our members, are going to become more and more demanding. They're going to want and expect PMI providers to give more care, better care, faster care, and sustainable care. And I think that flexing data, flexing technology, being innovative and moving forward and remaining relevant is the key for all of us in this industry to continue to provide for our members and grow our industry.
And I think we haven't really touched on sustainability, but the younger generation coming through will absolutely demand that.
Absolutely.
From an ESG point of view.
Yes, absolutely.
Which is the topic of our next Forward Thinking webinar. So thanks for teeing that one up, Dave. It's very easy. Do register for that one. We're looking at healthier planet, healthier people, and the role of ESG in the workplace. But no, we haven't finished yet. We've still got some time to ask some questions to our panellists. I believe Athos, Nikita, you'll be joining us. Dave, unfortunately, you can't make it.
No, sorry.
But thanks so much for joining us. Thanks to our panellists. It's been a really insightful discussion so far. We'll be back in just a moment for a live Q&A, so please get your questions in and we'll tackle those in just a moment. Hello everyone, and thanks for joining us. You've heard from us. We've had Dave Middleton, Athos, who's joining us today, Nikita discussing with myself the future of the PMI market, but now we want to hear from you. We've got your questions coming in, so we're going to field those questions to our experts, and we're going to take the next 20 minutes or so to answer as many questions as we can. So to kick things off, I've got some really good questions coming through. I think the first one to address is probably around some of the premium rate increases that we're seeing in the market. This is something we're seeing across all providers. But I guess the question coming from some of the attendees, especially one around kind of, is this the future? Are we going to see this continuing? And Athos, it'd be good to hear from you from a point of view of kind of how can we take a long-term approach here as opposed to a short-term?
Adam, it's such a good question, and it's such a difficult question to answer with a great deal of certainty. I think what we've all seen across the industry is that there is a significant increase in usage, and the multiplicative effect of an increase in usage and supply-side inflation is definitely causing the kinds of inflation that we're seeing in PMI premiums across the piece. I suppose that what we are expecting to see is that the new level of usage reaches a predictable pattern, and we can cost against that, and that supply side inflation comes under control as we're seeing inflation figures generally softening. We're hoping that the effect of those two things gives us a softer view of inflation going forward. There was also a question raised in the chat around what that looks like in the longer term, and how we can mitigate against that kind of inflation. And I think that the approach certainly that we've taken is, number one, to major on the prevention elements, to try and get as many people active and engaging in their own health and well-being as possible. And secondly, in terms of early interventions, and getting to the nub of things as soon as possible to control what happens downstream, and using guided pathways to manage some of those cost exposures. I think that the question around affordability is always one that I think we need to acknowledge is real. This cost of living crisis isn't imaginary. It is certainly something that is very real and is impacting lots of people, lots of households, lots of PMI holders, and we need to be cognizant of that. And I think as an industry, there's a big challenge for us looking forward to say, how do we create relevant, affordable, sustainable products for the long term? I hope that answers the question.
Yeah, almost a point of clarification. I mean, we are seeing where I think Dr. Keith was articulating very clearly in our claims data, how where we've seen increased usage of talking therapies, for example, we're actually seeing less costs for more severe inpatient treatment, showing that actually kind of costs don't necessarily have to go up, don't always go up through increased utilisation. But I think the point of clarity is almost that there's no getting away from utilisation is ultimately going to be driving a lot of this, and then you overlay medical inflation, and you've got ultimately some of the price increases that we're seeing. But I think the longer term approach, Athos, is the one that you're talking to. Actually, is around prevention, around flexible pathways, making sure that we are still delivering more to customers, but through the most effective means possible, so that we're not taking things away to save money. I mean, that's the last thing we want to do, right?
Yeah.
I've got a couple of questions coming through from a health perspective. Nikita, one for you, probably from the point of view of vaping, and Athos in the conversation earlier, you pointed to the fact that interventions around smoking and how that impacts surgery. How much do we know about vaping, and are there, is there enough evidence yet to be able to have similar kind of interventions around vaping, or do we just not know enough yet from a long-term health data point of view?
Vaping's an interesting one, and I think the feedback on whether it's good for you or not good for you is pretty mixed from healthcare professionals. In general, it's better not to smoke, and it's probably better not to vape, but we don't know. We don't have the evidence like we do for smoking at the moment.
Great, thanks, Dr. Nikita. I think moving across over to another question I've got coming through from Zane Martin. I hope I pronounced your name correctly. So, Athos, your comment that the best improvements we've seen are those who are not in the best health are very interesting. However, those in poorer health are less likely to either take out PMI or unable to get it due to pre-existing conditions. So what are the panel's thoughts, and this also carries across to you from a clinical perspective, when it comes to encouraging people to first of all consider PMI and get access to it, and then from a provider point of view, how can we make sure that it's accessible, that people get access to it, and then we are able to then support their health once we have access to them from a data point of view and wearable technology, all things we've discussed today.
Adam, I think that we should probably draw a distinction between people who are not in good health and people who have significant pre-existing conditions, which from an underwriting perspective are preclusive. The second category, I think, again, is an industry challenge, and I think it's something that we're going to need to evolve with. I don't know what the answers are, but certainly there's a changing demand from the public around how they want to access healthcare. And I think it's a challenge for us as an industry to figure out ways to make that more broadly accessible. But that's a very big question, and it points to a large overall of the system that we know and understand. But for people who are perhaps overweight or overweight and smoke, or overweight and smoke and don't exercise sufficiently but are still able to access PMI, the benefits are significant, and I think that's what I was pointing to specifically.
Yeah, and I think also it talks to some of the behaviours we're seeing, and the consumer survey poll that's mentioned in the broadcast, that actually I think 70% of consumers now are kind of considering PMI at a younger age. I think that's around the figure that we're looking at, and actually that's really interesting. I think that the consumer base has changed as needs have changed. So actually, for intermediaries, whether they're employers or speaking to individuals, I guess it's about kind of having those conversations about PMI, earlier, or for different reasons, especially for younger individual clients, for example. They may not have considered the need of for PMI 5-10 years ago, but actually, from a kind of age consumer point of view, but actually now they're much less likely to have a pre-existing condition. So to start those conversations earlier, maybe. Any thoughts?
Adam, sorry to interrupt you. There's another link that I'd like to make here, and a number of the questions have been around premiums and premium sustainability, and also how claims impact renewal pricing. And I think there's an important link to be made between engagement in the program and cost containment, because when we look to calculate renewal premiums, we obviously look at factors like age, medical inflation, and obviously claims experience, and that's really clear and transparent in consumer business, because we have the ABC methodology, which I hope our audience knows and understands. But in terms of your engagement in the Vitality program, that does also help mitigate future cost increases, and I think it's something that we probably don't talk about enough in terms of the multiple benefits of that.
And that also applies into the workplace as well, right? In terms of improving claims experience down the line.
I think that's what we're really trying to look at from a clinical perspective. We're looking at from prevention all the way through to claim, and looking at, well, what are the conditions that people are claiming for? What can we do in our everyday care proposition and within the Vitality program to really support people to make a difference? I think what Athos is saying around the engagement in the Vitality program is so important to us, and it does help mitigate it, but we try and do so much to make it as easy as possible to access, and to make it fun enough to engage in and really make people want to do it. And I think that is slightly different. There is, yes, we look at sustainability, we look at our journeys, but the key differentiator for us, I think, is that we want people to use our services, and we want people to get the rewards, because we know that will drive sustainability for us.
And improve retention, ultimately, more engaged and individualism. They're going to live longer, they have less chance of making a claim. That shared value model that you mentioned earlier, Athos, and engagement being the unlocker, unlocking that shared value for everybody. A lot of questions coming in about moratorium underwriting. Athos, I mean, might be a good opportunity to talk our audience through the full medical underwriting, the automated underwriting that we've introduced for individual PMI.
Yeah, but we're trying to make underwriting as simple and seamless as possible. I think there are a lot of questions coming in which relate to underwriting types. And I think that what I'd like to propose is that rather than try and go through each of them individually, we'll go back to each of the questioners and give them specific answers to the underwriting type questions. And also there are a number of questions I'm seeing coming in around specific claims examples. I think I'd rather that than address those individually, that we'll go back to every single one of those questions and answer them specifically. if that's okay.
Yeah, but a word about full medical underwriting in the introduction of that. I think being able to provide full medical underwriting in an automated way is ultimately allowing us to put individuals on risk without having to exclude conditions.
Exactly right, yep.
Yeah, and probably got a conversation below the line for those that are interested. Loads of questions coming in. I'm just going to sort of sift through a few of them. We've got about 10 minutes left. Question coming through from, this is a really good one, from Erica Giovangas, around digital care, really. Some customers ultimately, some clients, some of our members, they're ultimately going to prefer to call in. So how do we make sure that the service is there, that they're able to, if they want to pick up the phone, if it's a sensitive topic, if they're worried about symptoms, or they're going through a cancer diagnosis, they may not, they may want to speak to someone. So what's our, for both of you, what's our stance on that?
So I'm going to leave the clinical side to Nikita, but I'll just talk about the process side very quickly. We have obviously invested a lot of money in Care Hub, and the reasons for that is multifold. I think from an ease of access for our members, it's critical. From an efficiency of service delivery, it's critical, and from a cost perspective, it's critical. I think that the most important thing to answer the question, Adam, is that we obviously do not expect people to only enter the process or stay in the process through one methodology. People can start their journeys online and break out into voice at any time. They can start their journey in voice if they want to, and enter the digital methodology should they want to. It's always channel of choice for our member. And what we do see, interestingly, is that there's certain things where people want to talk to us. So, for example, if this condition has something to do with my child, I'm wanting guidance and help and hand-holding because I need to be reassured. But in other instances, perhaps where it's quite personal or sensitive, people will trade digitally throughout the entire process. But the important thing is that we allow that interaction to be in and out of voice all the time, entirely at the member's discretion. And
the customer charter that Vitality recently brought in was to very much drive up that servicing standard, right? And we've seen the trust pilot scores, I think, up sort of 4 out of 5, they're really high, a lot better than where they have been. So I think actually there's been a lot of work behind the scenes, isn't there, Athos, to drive up that servicing and free up capacity for our phones.
Absolutely. And I was actually checking the Trustpilot score this morning. It's actually at 4.2, and that's compared to our peer group, we're in good shape, and it has significantly improved. We did see, as most people will know, some difficulty around claims some time back, but I'm pleased to say that is a thing of the past, and the feedback that we get across the claims journey is really, really positive now.
And Nikita, from your point of view then, what's the best, sort of, how do we get the balance right? Because those that could go through something that's some symptoms, some conditions, some claims are probably better suited to a digital pathway. Others might be suited to more of a telephone-based one. So how are we making sure that, first of all, how do we kind of draw the lines? And then secondly, how are we making sure that the customers know that they're going to the right place?
I think, Adam, I'd actually probably look at it from the other way. I don't necessarily think it's journey specific. I think it's person specific. It's got to be what feels right for the person. If digital is easy for the person, we'll make digital as easy as we possibly can. With regards to the Trustpilot feedback and the sentiment and everything we gather, we look at every single piece of feedback every month to see what is one person saying, and is there an issue in that? And we're constantly looking at driving efficiency across those pathways. I think that for me, from a clinical perspective, it's got to be safe. That's the biggest thing. We can't drive a digital experience completely if it's not safe to do so. We've got to make it bespoke, and we've got to make it person-centric and not journey-centric. Does that make sense?
Yeah, no, that makes perfect sense. Putting the member at the heart of the journey is something that's kind of come up quite a lot today. I like this question coming through from Joy Croft. So in terms of business accounts, probably one for you, Athos, and employee engagement, is it down to the broker to get members involved, or is it down to the employer? Is it down to Vitality? Combination of all of these? I think it's a really good question. It's going to take a lot of time. We've got to acknowledge it's going to, if it is coming through the broker, it's going to require a lot of time and a bit of extra effort. So how do we best support them in that? And connected to that question as well, we've got any tools. And one thing I can think of is the return of investment and sort of we have with Vitality, which shows something the value that can be extracted from the Vitality program for a client. But yeah, Athos, over to you.
Absolutely. So I think it's a combination of all of those things. Certainly, we have a number of tools and resources to assist our intermediaries in helping their customers to engage with the program. We have things like our Vitality Champs. We have the ability to go on site. We have pre-prepared quarterly materials that we release around topics like mental health. We have loads of collateral to support all of that. So I think it's a combination of all of those things, but Vitality are absolutely 100% behind assisting and enabling both our intermediaries and our members to engage with the program. And there's a wide range of things, and depending on the size of the group, we deploy different resources. But we absolutely have the resources to assist in that engagement process.
Brilliant. I think reach out to your BC, right? Is the message there, isn't it? Reach out to if you have key accounts kind of personnel, that they will be able to support you with the tools you need. I think there's always more we could do. I think one of the questions came through around how to explain the videos. And we do a lot of resources, but I think there's probably an opportunity for us to make sure that there's enough kind of like support from a marketing point of view as well, direct to member, direct to broker, and direct to employer, right? But the Champs Hub and Champs servicing support that we've recently launched is probably worth noting. I like this question, and there's probably one for you, Nikita, from Phil Horton. In terms of prevention, how can Vitality educate on the importance of strength and lean muscle for MSK?
Great question. I think that, do you know what, there are so many different health. There's so much research coming out about so many different things in health. And I think before we educate people on a specific thing, we have to understand how much impact that has on the overall health and whether that has more impact than something else. I think for us, it's really key to support people to make the right decisions. And I think telling people that potentially they need to stop smoking and lose weight and build some lean muscle, and perhaps, lots of other things. It's really, really hard. So we have to make sure we're getting the right messages and supporting people with the right things to get the greatest health benefit they can.
No, that's really helpful. And I think one I can maybe answer as chief editor of Vitality magazine. We've also got the content hubs we do for advisors and other members of our audience. But actually, I think a lot of the articles that we do are around kind of tips to strength train. We've obviously got the Vitality coaches that go into through their wellbeing webinars, kind of help support those kind of thoughts. So I think Nikita, maybe the point as well is the support's there for those that want it. You can lead a horse to the water, but you can't make them drink. So as long as we make this information available, as long as we're putting out the things that we believe that are going to be helpful based on clinical evidence, clinical insight, and based on the proposition that we're providing, and given connecting to the tools that we have on offer, those that want to self-serve, and we also use personalised recommendations. That's come up quite a lot within the Vitality app. So articles that individuals are seeing to the Vitality blog are tailored to the information they've received through their health data review, for example. So if you're scoring low for mental health, you might get an article and some kind of an invite to a webinar, for example, that would support your mental health tips. So I think there is a way to influence behaviour and support, and MSK is definitely one that's on our list of topics and interests.
Yeah, exactly. But I do think that we have to choose the areas that have the greatest ROI and drive that sustainability for our members. So it's the right things, but supporting people, yes, with the editor, with the kind of, we like to keep a lookout on everything. There's lots of different things. There's strength training, intermittent fasting, Mediterranean diet. There's so much out there, and we have to choose the right things.
I completely agree.
Comes back down to personalization, next best actions, and making sure that the member's at the center of this thing, rather than broad brush approaches. Adam, I just wanted to mention one thing, and I know we're running out of time, and there's so many great questions that we do need to answer. I would urge that people speak to their BCs or their BDMs, because you were going through some of the collateral and assets that we have available and support mechanisms that we have available. And I think oftentimes that's our challenge, is that there's so much, where do you start? But I would just urge that people speak to their BCs or BDMs and ask those specific questions, because in all likelihood, we already have those in our arsenal to deploy for you. There's some questions around how I start selling PMI. Again, that's besides a lovely question to have, it also says that some of the content is resonating from Paul Hart. Paul, again, if you just reach out to your Life BC, they'll be able to help set you up. And I think that the attendance today has just been absolutely astounding. I think we have over 1,000 people who've watched the webinar. That's really that's so heartening for us, and it's why we do these things. So thank you very, very much. Back to you.
Completely agree, Athos, and just to echo that, really, thanks to everyone that's dialed in. Thanks for your questions. I'm very sorry we haven't got to them all. There have been so many of them, and as Athos said, there are lots of opportunities to have conversations outside of the webinar for us to address some of the questions you're asking, to go deeper into some of the resources that are on offer. We will be sharing a survey at the end, so please do take the time to quickly fill that out. And actually, one of the questions asked in the survey was, would you like a follow-up call from any of our business consultants or people within the business that can service your requests and questions and tell you more about some of the things we've discussed today. So, yeah, hopefully we've given you lots of food for thought. Hopefully you've got some value from the discussion today. Once again, we regret not being able to ask all of your questions, but yeah, there's lots of opportunities to continue the conversations offline. Nikita, thanks for your time today. Athos, as always, fantastic, and also to Dave Middleton as well, who joined us earlier. But most of all, thanks to you for joining us and for your engagement today.
Thank you, everybody.
Thanks.
See you next time.